Good morning, everyone. And thank you so much for that warm introduction. And I just have to say, it is just such a pleasure to be here, such an honor. Maine is near and dear to my heart in so many ways. For the last 10 years or so, my husband and I will often camp at Bar Harbor or go to Ogunquit, and so Maine always has a piece of my heart. But I'm also really pleased to be here because, the work that you all are doing is just so incredible. It is life-changing, it is life-saving. And so, again, just such a pleasure. And I want to thank the governor, Governor Mills, just for the commitment to this work, and Commissioner, Director Squirrels, for the amazing work that's happening really across the state. So appreciate Gordon. I had the opportunity to speak with Gordon at our naloxone saturation policy academy, and we said this year we're really going to sort of make it happen in terms of working with my schedule. So again, it's just such a pleasure to be here. And each year that other SAMHSA members have come to this conference, they've come back and said, it is just an amazing conference. The energy, the vibe, the work that's happening across Maine is really something to witness. And so, again, just such a pleasure. We often talk about just the creativity and the ways in which Maine is implementing our state opioid response grant as well as other grants, and creative work focusing on correctional settings, and creative work that's happening within tribal communities and tribal settings. And so again, just so applaud the work that's happening, and know that we are partners, and that you can continue to reach out to us as needed to advance this important work. And so welcome, everyone. I mean, it's just a pleasure to be here. To those online, happy to share a quick update and some of the work happening at SAMHSA. I'm going to try to be disciplined and keep my remarks somewhat brief, maybe 15, 20 minutes, I think 20 minutes or so. And then I believe we have time for a couple questions. Is that still the case? But yes, so great. Okay. So real quickly, I'm just going to do a quick budget update, just show you a little bit about some of the resources, where we're focusing. Our resources absolutely align with our strategic priority areas. We'll share a little bit of data, and we'll go through that quickly because we've talked, and you've heard a little bit about some of that already in terms of some of the dips that we're beginning to see. We still know there's a lot of work to do there. We'll talk about some policy updates and some of the work happening across SAMHSA in a number of different policy areas. And then we'll continue on and talk about some of our substance use and prevention related work as it relates to addressing overdose, and then we'll have time for discussion, so looking forward to that. In terms of our budget, I mean, this is just a quick snapshot. I certainly have been grateful in my time as Assistant Secretary that we have received consistent resources to be able to continue to address the overdose trends we're seeing, to continue to address the mental health related trends that we're seeing. And our work often is about trying to get it out as quickly as we can in different grants or contracts, and to continue to partner with all of you who really are doing such amazing work on the ground. We often say that we cannot do this work alone, and so our budget is very much about then enacting and standing up important partnerships to be able to advance and partner so that the important work that you all are doing can continue as well. Real quickly, in terms of the President's FY25 budget, there are some areas that, again, align with some of our strategic priority areas that we have asked for additional resources. For example, about $20 additional million we're requesting for the State Opioid Response Grant. We know that that is such a valuable grant. It funds a broad range of prevention, treatment, recovery, harm reduction. And I can say in my job and in my work as Assistant Secretary, I have so appreciated going around the country and seeing the ways in which those resources are meaningfully being used at the community level to outreach and connect with people who are struggling. This work is near and dear to me. It is near and dear to my heart. I have family members that are included within the groups of folks that are being reached out to and connected with and connecting with services. And so, we are all in this together, and I'm grateful for the work that everyone is steeped in. We have an additional 20 million or 10 million that we're requesting for our harm reduction programs, and we know that that harm reduction is so important. We're hearing that that is not getting a lot of love right now in the initial House markup, but we are confident that where we land will include additional resources, because we know the harm reduction work is about ultimately meeting people where they are, helping to keep people safe, helping to keep people healthy, alive, and in many instances, we're seeing a lot of work happening related to connecting people with meaningful services and supports as well. In addition, our PPW program, Pregnant and Postpartum Women program, requesting additional resources there. We did recently award about $1 million for the PPW program. And again, we know that is so important because we know it's so critical to be able to keep families together and for women to get connected to the needed services and supports when they're struggling with substances or even mental health challenges, to be able to keep families together to address those needs. So this is just a quick snapshot of the FY25 sort of budget request. We are optimistic that many of these areas will remain. Real quickly, in terms of data, you know, we're like everyone else watching the trends. I think some of the trends that you're seeing here in Maine, when we look across the board, you know, recent CDC provisional data suggests that we are seeing a slight dip in overdose rates. You know, we still have a lot of work to do. They're still far too high. And the fact that they're so high is very much a call to action, right? It's a call to action that lets us know that it's critical that we continue to double down on all the areas that we know are making a difference, expanding those areas, scaling up those areas we know that are making a difference, and certainly that's something that we are committed to. But it is heartening to see that the trends are going in the right direction, but nevertheless, we have a lot more work that we still need to do. When we look at some of the trends just based on substance, you know, what we see is that, you know, continually synthetic opioids, so fentanyl and other synthetics, are driving and continue to drive the trends that we see. Psychostimulants, as well as cocaine and other substances as well, are contributing. And of course, we see quite a bit of polysubstance use that individuals are struggling with. And so, again, lets us know that the work around continuing to get naloxone and other overdose reversal medications out far and wide, that remains important, as well as the range of work that's happening across the country to be able to meet the needs of individuals that are struggling. Why not now, in the next few set of slides, just share some of our resources and programs and initiatives that we have in place, very much in partnership with all of you. And we'll share some of the vision related to these works and some of the next steps as well. One thing I wanted to talk about is our overdose prevention strategy, our overdose prevention and response toolkit. There is a QR code there for that. Please help us get this out far and wide. It is such a valuable resource. It is an update of this toolkit, and it includes information around sort of overdose reversal strategies, information about prevention, harm reduction, really quite rich, and you have the QR code there for that. A lot of content related to responding to an overdose. We know that is so important. It's not meant to replace the training, naloxone and training related to other overdose reversal medications, but it is a really important, I think, addition or addendum to some of that work. So please help us get it out far and wide. That you have the QR code. It's also available on our website, so you can download it on our website as well. Wanted to talk real quickly also about our state opioid response grant. We did recently release that grant, so I know folks, states are working on that, territories and also our TOR grant, tribal communities, are working on that as we speak. There are a number of changes that were included in that, very much in response to what states were sharing with us. Typically, TOR was a 2-year grant. We have extended it and made it a 3-year grant because what we were hearing is that it's you know, it's a lot of resources, and sometimes with hiring or just the range of like setting up different programs or initiatives, a 3rd year would be helpful. And so we figured, you know, we can definitely do that. This new TOR grant also builds on and really stresses the importance of continuing to do the work around disseminating naloxone and other overdose reversal medications far and wide. States are working on and developing plans related to that. Quite a bit of focus also on the importance of really looking at the full continuum, so not just adults, but also thinking about addressing the needs of young adults as well. Unfortunately, as we look at the data and some of the trends, we are seeing overdoses at younger and younger ages, and so so important to be able to address the needs of young adults. And it's been wonderful to see the work in terms of standing up and disseminating naloxones within school settings as well. Also, a lot of language in there around really taking a total person approach, and then ensuring and expanding access to medication for opioid use disorder. One thing we've been really, really pleased to do is to work with states around naloxone saturation. That we've been holding policy academies. And the goal of the policy academies is wonderful. States will bring forward planning teams, and then the teams develop plans related to getting naloxone out far and wide. Last week, just held our third Naloxone Policy Academy. Maine participated in our last Policy Academy. And in addition to the academies, we have, we call them our the learning communities. So there are calls in which states who have participated in the policy academies, as well as others, can come together to share content around sort of what's working, what's not working, and to be able to continue to move their work and move their plans forward. So really excited about that work, and so appreciative of the partnership with everyone along those lines as well. Just to share a little bit of data, we have seen an increase. So naloxone is getting out there. And we know that's so important. We want, if somebody is struggling, we want them to be able to, and the people around them to have naloxone to be able to intervene. We have seen a 36% increase in the dissemination of naloxone over a 2-year period. And so again, I so applaud the Maine team, whether it's the community providers, the work that's happening at the state, because it's making a difference in terms of continuing to ensure that naloxone is available. So thank you for that work. In terms of just some of the trends, I mean, when we look across both SOAR, so the State Opioid Response Grant, and the Tribal Opioid Response Grant, and when we look from 2018 to the end of last year, what we find is about 1.3 million people have been connected to services and supports, and about 9.9 million naloxone kits disseminated. And so that is, I'm just so appreciative of the dedication and the passion and the commitment that's happening at the community level, and with states to be able to get this life-saving, overdose reversal medications out far and wide. Also quite a bit of work related to disseminating fentanyl test strips. And we know they make a difference as well. What we're hearing is that people appreciate being able to test substances, to know what's in them. And so quite a bit of work around disseminating and making fentanyl test strips, as well as xylazine test strips. They can now be used, or our federal funds can now be used to purchase xylazine test strips as well. And we've seen over 550,000 overdose reversals. And for me, I mean, it's heartening because it means over 500,000 more individuals that have the opportunity to experience long-term recovery and to reclaim all those things in their lives that are meaningful to them. So I'm grateful again for the work that's happening at the community level. Want to talk real quickly also about our harm reduction work. I'd mentioned earlier that we are requesting an additional $10 million for our harm reduction and community engagement related grants. Some of how this came about 2 years ago now, maybe 2.5 years ago. Rahul Gupta and I did a roundtable after the RX Summit. And one of the things that was shared is that, people want to see more grants at the community level for small organizations that are already doing this work, to be able to do more harm reduction related work. And then members of our prevention team also heard similar things that, we really need to get additional resources out far and wide to recovery organizations, to harm reduction organizations, to state health departments, just far and wide. And so this grant will ultimately award an additional 82 grants. We're planning to be able to reach about 181,000 additional individuals. And so we are optimistic that will remain in our budget, in the final budget, but we know it has a way to go. Also, we're continuing to fund the Harm Reduction TA Center, and then looking to develop guidance around the intersection of harm reduction and recovery. We were really excited earlier this year to be able to convene and bring together individuals from the harm reduction community and the recovery community to sort of share space together and really unpack what are the important areas of overlap? What are some of the areas of difference? And what are some areas that the two communities that ultimately sometimes have different visions, but have a lot in common as well? What can be done together in a shared way? And so we're really excited about that work as well. In addition to that, stay tuned there, because we're looking to continue to bring the groups together to continue to work on and develop some areas of common work. Last month, actually might have been about a month and a half ago now, we were so thrilled to be able to announce the winners of our first ever Fent Alert Challenge. And what this was, it was a challenge that we put out to young folks, 17 years of age and under, so 17 and under, around sort of developing messaging, like please help us with messaging around the importance of raising awareness about the dangers of fentanyl overall, within fake pills, within other substances. Send us your ideas and let's develop and work on developing ads and just awareness raising events and content together. And so these are the winners. We had 21 individuals overall, 6 first place, and the remaining individuals were the second place winners. They did receive additional resources to help to continue to advance their ideas. The content is available now on our website, and so you all are welcome to access that, share that as well. We're going to play a really, really brief video. It's just a clip of snippets from the 6 winners, and so I think we have a link to that in the slides. Oh my, maybe I'm not able to play it. Oh, they have to do them back. So is that possible? I'm not sure who's running the computer, but if you click on that video clip link, that should take you to a quick video that is just a compilation of the Fent Alert Challenge. The young people were amazing. I mean, what they sent in, it was just so creative, and quite honestly, we were a little bit stressed out trying to pick 6 winners because they were all so good. But hopefully we can play that, and then if not, we'll make sure everyone has access to it. Yay! Oh, you guys are awesome. Thank you.
Never asked how you was doing, now I'm seeing it was better you was doing. Man, I always thought that you was stronger, I thought you was a father. You had something to lose, who gon' care for your daughter? Stay strong, that's what you was telling me to do. Now I'm staring through your window, seeing your body turning blue.
Escape Room, Maryland.
7 out of 10 fake prescription pills seized by the DEA contained a potentially lethal dose of fentanyl. With no luck in finding her at school or her favorite hangout spots, you decide to search her bedroom for any kind of clue you can get your hands on. With time ticking, you have to find your friend before it's too late. Can you do it?
Narcotic Nightmare Game, California and Hawaii.
We would like to introduce our new game, Narcotic Nightmare, which allows youth to investigate the fatal formula inflicting the main character in the game's plot. In the game, players act as investigators, tasked with uncovering mysteries surrounding various substance-related deaths.
Project Fentanyl, New York.
For 90% of American teens using social media on a regular basis, it is a great place to promote fentanyl awareness. My videos feature 3 different fentanyl-related topics that all teens should be familiar with. These topics are fentanyl overdose symptoms, the benefits of naloxone nasal spray and how to properly use it, and the dangers of fake pills and emerging drug contaminants.
Safe Youth Ambassadors, Florida.
For over a year, we researched fentanyl facts that we thought teens could relate to, with a focus on the dangers of counterfeit pills bought on social media. We met with police, legislators, and victims' families, and then combined all what we learned into a 9-minute multimedia presentation to share with our peers.
Show, Don't Tell, New Jersey.
The best way to educate teens is to encourage young animators to create short animated videos that visualize the symptoms and effects to give teens a deeper understanding on how fentanyl affects one's body.
Congratulations, winners. To learn more, visit samhsa.gov/fentalert.
Yeah, aren't they amazing? Yeah, thank you. They just did such a great job. We were just so proud of all of the content that came in. Again, it is available on our website, so you're welcome and free to share any of that content. We are looking to hold a youth summit in the fall, and so that will be another opportunity for some of the youth to come together again, and so really looking forward to that. We're also looking to, in terms of just other resources, you may have heard about our Screen for Success app, and so we are looking to update that to have additional content for providers, additional content for parents, more vignettes. So excited about that app as well. And it's been award-winning. It's won some awards, so do take a look at that. That also is available on our website. Also wanted to share, 42 CFR Part 8, as you know, that we updated that. It had been, I believe, 20 years or so since it was last touched. And so just so pleased to be able to get that over the finish line. We were so grateful for all the feedback that we got related to that. It does go into effect October 2nd, so it's coming up. Again, you do have the QR codes. So I love seeing the phones go up and folks getting that information. Aren't QR codes like amazing? They're just amazing in terms of being able to share info quickly. But some of what we're looking at to work on there moving forward is just, working with states around and communities around and OTPs around implementation and any work that may be needed there with respect to implementing 42 CFR Part 8. And we will be sending out a letter soon, and then we anticipate meetings and some of those webinars and convenings starting in August, so stay tuned there, which is like right around the corner. Real quickly, ESPERT was mentioned earlier. I won't spend too much time here. This is such an important grant, though, in terms of being able to identify folks early and then ultimately connect them with services and supports. We see some areas where the data goes right in the direction that we would want. Other areas that suggest, sometimes with 6 months, people may need a little bit more time for some of the pieces to sort of see impact. But overall, we were really, really pleased to see, some of the changes and improvements with respect to a couple of the areas there. That may be a different slide than the one that we were planning to. But nevertheless, ESPERT is an intervention that we're committed to continuing to advance and move forward. I'm going to try to go through these last two pretty quickly because I do want to leave time for a discussion. The other thing that we were really pleased to get out is our core curriculum elements for substance use disorder. One thing that we know is that training programs could do a bit more, right? Could do more with respect to training individuals to be poised and ready to be able to address substance use within their practices, whether it be primary care physicians, nurse practitioners, really across the board, even within psychology, psychiatry. And so this core curriculum, it outlines just areas to sort of consider and areas that are critical and important to include within curriculum, including sort of history, overview of SUD, screening strategies, treatment strategies, And so we're really pleased to get that out as well. And there's a QR code that can connect you to additional information there. Lastly, almost lastly, I think there's one more after this, but we are so thrilled to bring back our Recovery Star Awards. The Star Awards are, you can nominate folks who are in recovery with lived or living experience. And ultimately, it's just an opportunity to honor the great work that they're doing in terms of bringing hope, helping people to find recovery, to stay on the recovery journey, to navigate services and supports. And so certainly that is an opportunity to recognize folks. And I believe that it just closed, but we will be honoring folks in September, so stay tuned there. And then we have our Art of Recovery. And so that's something that we're probably going to do on an ongoing basis, but we did receive over 300 submissions. And what we asked for there was folks to submit content related to recovery and just express it through art. And our intention is to develop an online gallery related to that. And so again, thank you so much. So appreciate the opportunity to be here. Appreciate the work that you all are doing. And I'm going to stop there. And I believe we have a bit of time for questions. Yeah.
Microphone up front here. You use the microphone.
And Gordon, you just let us know how much and how much time, and because I want to be respectful of. But I come from a big family, so I love the discussion. I don't want to. Yeah, and I know you all are steeped in the work, seeing things. Have ideas for ways to advance, so definitely looking forward to questions.
Scott, use that microphone, Representative Searway, State Legislature.
Thank you. I'm Representative Scott Searway from Albion, Maine. I've been a senator for 8 years and then went to rep, and now going back to Senate. So I've been on the opioid task force. So I just lately, I've seen a lot of suicides, hangings. We had that 4 in one day in one town. So that just happened last week. And then we had an officer, thank God for Narcan. There was a lady that was stumped over the steering wheel, and she had her foot on the pedal, and she was unconscious. He reached in to shut the car off, and he got exposed. He barely made it to the cruiser, and Narcaned himself, and so he did get recovered, and so thank God for that. So I know the Narcan, there's a new one out like 5 times even stronger than what we've been dealing with. And I don't know what's being done with that. And also, is the suicide being counted on the overdoses, or how's that work?
Yeah. And so it sounds, my sense is that states may manage that a little bit differently. It sounds like here in Maine, it is counted, and Gordon can share more there. I remember in Connecticut, if it could be teased or sort of figured out based on the scenario, then certainly was included. I think really what it lets us know is that there's more that we need to do to really let people know that there is support available. And that's why I think the 988 work and helping people to know that 988 is not only for folks struggling with sort of mental health related crises, it's also for folks struggling with substance use related crises, or in addition to suicidal ideation or any other mental health challenges. And so some of the work over the next, certainly moving forward, is around sort of continuing to build out that part of the messaging to let folks know that if they're struggling with substance use as well, please do call 988. Maine, again, has done such a fantastic work here. Across the country, we see 10 million. We just hit 10 million calls, texts and chats that came in over 2 years. But certainly, I think there's more that we need to do there, because our numbers for both, for suicide as well as for overdose rates are too high.
Thank
Yeah,
you.
thank you. Thank you for your work. You know what? One thing I will share, in addition to the line, what's been important to us is it's not just about making sure that the call centers are strong. It's also about continuing to build out the rest of the care continuum. So, the director mentioned it earlier. We're also continuing to expand CCBHC, so Certified Community Behavioral Health Clinics. They are so important because for folks that do need to connect to additional supports, it's important that they have somewhere to connect. And so CCBHCs are one opportunity, in addition to expanding mobile crisis, so that there is somebody, there is a team that can go to them if necessary. And then the stabilization centers, we're seeing that as an important goal as well, and supporting that as an important alternative, right, to emergency departments. We know not everybody needs an emergency department, but a stabilization center may be really helpful. So, thanks.
Good morning. Thank you for coming all the way up.
Good morning. Good to see you.
Good to
You're
see
everywhere because I saw you 2 days ago in DC.
That's right. But back in my home state, thankfully.
Yes.
So I wanted to, I guess it's more of an encouragement or a shout out for the suicide prevention strategic plan that was just released. There's not a QR code for it, but it's fantastic. And so I wanted to encourage you to highlight that, since there are so many good strategies, and that SAMHSA and Suicide Prevention Resource Center and others did such a good job, including the voices of living experiences throughout that process. So I thank you for that, and wonder if you wanted to say a few words about it.
Yeah, thank you so much. No, really great flag. And please do take a look at that. It is a new national strategy. So our 2024 National Strategy for Suicide Prevention, it comes with an accompanying federal action plan, and that federal action plan has over 200 items that are sort of in the process of being worked on, or that are coming up to be worked on, related to suicide prevention. I think it also is a really valuable blueprint for the rest of the country in terms of different areas to think about implementation. At the community level. So take a look at each of those: the 2024 National Strategy for Suicide Prevention, and then the federal action plan that goes along with it. I think each provide really valuable content for areas to move forward. So, but thank you. Thanks for that flag. Great to see you.
Just these 2 questions.
Hi.
Okay.
My name is Lynn. I've lived both sides of this coin. April 5th, 1997 is my sobriety and recovery date. Okay, thank you. It's not about me. It's about helping others. So I've seen with my own, my problems and my addiction, and it is person fit. Mm-hmm. Not one person is going to help get recovery from another one, because we all live different lives.
Yes.
What I do know, what I've learned in my classes years ago, was that it is about the brain. It's what we want to escape from. What children go through. And I certainly had my escapisms. And today is definitely above all, because people want to play the games, want to be attached to the cell phone at the hip, which is a great idea for some of those programs to get the teenagers involved. Yes. Get them involved, get them right where they're hitting. And so, but yes, we need more in-house. In-house. We need places for people to go to get help so they can recover. Thank you.
Yeah. Thank you so much. Thank you for your...
Austin's also state legislator.
Yeah.
So he'll be the last question.
Okay.
Austin, go ahead.
Thank you, Madam Secretary. Austin Terrio, State Representative from Fort Kent. Quick question, and wanted your comments. I like that we're talking about dual diagnosis and increasing access to that, but I still sense, and at least from personal experience, a lot of people I'm dealing with have really underlying mental health challenges, and there still seems to be a huge separation between and a lack of wraparound services. So when somebody goes into a detox bed, for example, they may not be able to manage the detox because of the mental health issues they're dealing with, and they get kicked out and they end up back on the street. So wanted your thoughts on how we really have to move forward in that direction to look at this not just as one or the other, but both.
Yeah. Yeah, thank you so much for that question. I mean, I think that that is right on, that, often we know people are struggling with both. And so increasingly, we've been looking at that, like what are some ways that we can increase the opportunities and the chances of people being connected to co-occurring services and supports. So one thing, CCBHCs, so our Certified Community Behavioral Health Clinics, it does provide an opportunity for people to receive both mental health and substance use related treatment and services if needed, as well as to be connected to any other primary care services and supports. And really that's sort of the hallmark of that model. And we've really worked on sort of strengthening the piece around addiction. So for example, now it's a requirement that addiction professionals are part of the treatment team. In addition, a requirement more focused on sort of harm reduction, medication for opioid use disorder, to really bring that into the model more. In addition to that, CMS and SAMHSA a little bit, there's a new model we call IBH, the Integrated Behavioral Health Model. And through that model, it's, again, another approach that's taking a whole person approach to care. That is actually an 8-year grant, and so it's quite a bit longer in terms of the amount of time. But it is an opportunity, again, to build out those integrated sort of models of care. From a community-based perspective as well, that's also an additional requirement of the grant. But again, appreciate the question, and it is definitely an area of needed focus, and some of our training and TA centers are focused there as well. So, great. Thank you so much, everyone. Yeah, thank you.